Hi everybody, it's Dr. Magnifico from jrsfullvet.probably.com. This is Hank. He's about a 10-year-old beagle. He came to me for inability to stand or walk. When I saw him, it was Sunday, so it was almost a week ago. He had gone down on Friday, so that Friday his owners found him lying on his side and he was unable to stand or get up, and he was crying in pain every time they touched him. So right off the bat, my initial guess was he had intervertebral disc disease, which we call IVDD. If you search my blog, which is Diary of a Real Life Veterinarian, and IVDD, you'll find that I have quite a few blogs on this disease, so there's a lot of information there. I just want to go over on this video kind of how he presented and what you can do initially. So initially he was lying on his side, he was unable to stand, he was very painful when they picked him up, and he didn't progress from that. So right off the bat, my first guess was IVDD. IVDD is pretty common in a couple of breeds. Certainly the Dachshunds are the leader of that breed list, and then I do see it quite a bit in Beagles, and I also see it quite a bit in Shih Tzus. So those are the top 3 breeds that I see this in. A couple of things that were not in his favor: he was overweight and he's under-exercised. I do see this much more commonly in overweight Beagles. Same thing with Dachshunds, same thing with the Shih Tzus. So it's really important for those 3 breeds to keep them nice and thin, so trim and really athletic. We want to maintain as much muscle mass as possible. At the point that he came to me, he was very painful with anything I did. The other thing that was very important with him is that he had deep pain. So if I pinched his toes really hard, he would yelp out in pain. That signifies that his brain is talking to his spinal cord and that it's talking to his legs. That's a really important prognostic indicator for moving forward with this disease. About the only thing that your veterinarian can do at a general practitioner's office is do a physical exam. We also took some x-rays, so I'm looking for any evidence of fractures or dislocation in the spine. He didn't have any of that. There are, dogs or patients who have either been hit by a car. I've even had dogs who have run into a tree and they dislocate their spine. That's a different disease and a different prognosis and a different workup than IVDD. If your dog is acutely lame and your veterinarian expresses a concern for intervertebral disc disease, really the best option for you is to immediately go to a neurologist. The options from there are typically going to be surgical. The problem with that is that in my neck of the woods, and I'm in the Northeast, it's about $2,500 for an MRI. So they're going to do a more intensive diagnostic to figure out exactly where the discs are that have ruptured or slipped, and then they're going to talk about surgery. Surgery is about $7,500, so to work these guys up surgically needs to be done pretty quickly, and the cost of it can be somewhere between $5,000 and $10,000. Unfortunately for Hank, that was cost prohibitive, so they elected to do a conservative treatment plan, which really involves rest and medical therapy. Due to some kind of extenuating circumstances, he's come home with me for the next couple of days, so I'm really trying to provide him more care than he could get at the veterinary clinic. He was at the clinic for a couple of days, but he wasn't getting better, so he's come here for that. Initially, we want to put these guys on crate rest, so they're in a cage at all times, carried out to go to the bathroom, and then we put them on some medical therapy. But right off the bat, we want to be talking about his ability to urinate and defecate. Those are the 2 really important things. If they are not urinating voluntarily, meaning they don't empty their bladder, you need to talk to your veterinarian about how to monitor that, and then the same thing with defecating. So we have put him on a stool softener to help with that, and then I'm monitoring him very closely for his ability to urinate. Initially it's cage rest, it's pain medication. The most important thing is to manage their pain and then make sure things like their ability to urinate and defecate is happening on a regular basis, and they're not holding their urine, which can cause a whole bunch of other problems, or they're not holding their feces, which long-term can cause other problems, and then pain management. I'm also going to keep him turning, so I'm not letting him lay on one side and just one side. Your lungs, which are in your chest cavity, we want to make sure that they're staying even, so I will turn him over if he's laying down on one side for too long, and we rotate him. The other thing is I'm trying to keep him sternal. He's almost a week out and he's now able to stay sternal, so that's a really important sign. He's getting better. Although he's painful, which you can see by the moaning, the panting, and the restlessness, and sometimes they're even tremoring. Those are all indications of pain. So initially it's just managing their pain, making sure that they stay clean so that they're not urinating on themselves. As soon as he urinates, I give him a bath and I keep him on a pee pad to keep him clean and dry, and that he's emptying his colon. So the first couple of days, it's just managing pain, making sure they rest, and that making sure that you're keeping them safe so that their prognosis long-term is better. You know, managing conservatively is probably, you know, you probably can do it for your initial visit and then your radiographs and then your medications. You probably can do it for less than a couple $100, and certainly it's a good option for any dog who doesn't have surgery as a medical treatment option. If you have any questions about IVD in the initial stage, which is all we're going to talk about now, you can find me anytime at pavli.com or come visit me at my clinic at Jarrettsville Vet. I'm going to do a couple other videos on other parts of IVDD, like how you can manage physical therapy at home, and then what the medications to manage IVDD conservatively are.